Hey everybody, it's Michelle Shields at Friendship Health Center, and I wanted to talk to you today about glove use in hand washing and replacing your gloves. Gloves are an essential component of our standard precautions, and the proper use of gloves, removal of gloves, and hand washing are a critical component of best practices to prevent health-associated infections. This is especially important at Friendship when residents are more vulnerable to infection and they stay for an extended period of time at Friendship. So if gloves are used incorrectly, not removed, not hand wash or hand sanitizer in between, if gloves aren't replaced when they're supposed to be, then you're not following best practice, and pathogens can easily be spread to patients and their environment. So let's talk about some scenarios. So you have a patient that has a tube feed and they have a PEG tube, and so you have medicines ready. You wash your hands when you go into the room, you put on gloves, and you administer those medications through the patient's PEG tube. Now, you've flushed it, you've done all of that stuff, and you're done with your med pass, and you notice that the dressing around the PEG tube looks like it may be oozing a little bit, and you want to go ahead and change it and clean it up when you're in there. So you remove the dressing and you clean it and you put on a new dressing, and then you remove your gloves and you wash your hands and you leave the room. So what did you do wrong there? Well, you did great all the way up to the point of completing the med pass for that patient in their PEG tube. You should have changed gloves after your med pass was completed for that resident. Removed your gloves, either washed your hands with soap and water or a hand sanitizer, replaced your gloves, and then you should have removed the dressing. Yeah, here we go again. Remove your gloves, wash your hands with soap and water, or use hand sanitizer, put on new gloves, and then clean the wound. Throw all your stuff away after cleaning the wound. Remove your gloves, wash your hands with soap and water or hand sanitizer, replace your gloves, and then put on a new dressing. Then remove your gloves, wash your hands with soap and water, hand sanitizer, and then you're good to go on to your next patient. Or a different skill or task for the resident you're working with. If you have any questions, please don't hesitate to come and find me. I'm either in my office, you can call me on my phone, you can send me an email, but it's pretty simple. That's the best practice for standard precautions. That's it. Thanks. Bye-bye.